Good morning, everybody. It's Daniel Whited calling you from the roads of Pennsylvania, the backwoods here. We're driving into Lancaster, and welcome to the Doctor's Clinic Call, where the world is your waiting room. And we are in a position at Sizzle International where we're using what I want to refer to as cutting-edge science. And we're kind of ahead of the curve in a couple of products that we have. Matter of fact, Curt, I think even the fucoidan is ahead of the curve on what anyone else has their hands on, based on the potency and the power and material. E pill, and then the RIP formula is absolutely a life changer. Curt Ficenec is with us today, and excited about come on, go in kickback mode, and if we lose you, we'll hop back on. But anyways, everybody, here's Dr. Curt Ficenec.
All right. Well, thanks, DW, and exactly. You know, we're so cutting edge on everything that we do. It's just amazing. I had Tom talk to my friend Dr. Kim the other day, specifically on fucoidan, and he went through everything with that. And Dr. Kim had been familiar with another product that had used the fucoidan molecules, and they compared it, and they went through for about an hour and just compared it. And it was just, I mean, it just blew me away. Every time I hear about what we have, there's just things that I find out, and I find out how much more potent that we have. So DW, while you're traveling through the mountains of Pennsylvania, guess where I am? I'm out here in Colorado, and I probably can see the roof of your house from where I'm at. So anyhow, I'm out here. I've been here for a couple of days doing some presentations, and Dr. Kim, are you with me?
I'm here. Can you hear me?
Loud and clear. Dr. Kim, Perfect. If you'd want to, would you want to give everybody a little background of you know, kind of how you got into, maybe even into chiropractic, but how you got into natural medicine and kind of what you've seen happen over your career as a chiropractor?
Sure. I'm one of those guys that I grew up thinking that chiropractors were quacks. That's all I ever knew until I got married and was in my late 20s, I guess, and I had suffered from allergies all my life, and my wife suggested I go to a chiropractor. And you know, quite honestly, I thought she was kind of crazy, but for those that are married, you know that when your wife suggests something, you better, or you know you're going to end up doing it anyway. So I went to a chiropractor, and I'll be darned if my allergies didn't start getting better pretty darn quick. So that kind of opened my eyes, and I had been I left high school, went in the Army, went to Vietnam, got back from Vietnam, and I went in the insurance business. I had a good friend who said, "You got to come in here." I had no idea what else I was going to do at the time, so I spent about 10 years in the insurance business, everything from being a health insurance specialist to life insurance and even some securities. And I was at a point where I just couldn't see myself doing that the rest of my life. I just wasn't happy, and I got really intrigued by this chiropractic thing because I got such great results. And I remember saying to my doc, I said, could I do what you do? And he said, I don't see why not. So I made up my mind I was going to be a chiropractor. I went home and told my wife I was going to quit my job and be a chiropractor, go back to school. And she said, well, that's great, because she was at the doctor this morning, found out she was pregnant again. So we had a real life-changing day. And I ended up going to chiropractic school. I had no prerequisites. I had to get all my prerequisites done. I was working, going to school, and then we moved the wife, and at the time 3 kids, down to Georgia, and I went to Life College down there. About halfway through chiropractic college, I was having a tough time there because some of the stuff they were trying to teach me just didn't kind of jive. And then I met one of my instructors was a registered nurse who was in this technique called neural organization technique. She said, Kim, you got to go to the seminar. And at the time, you know, this is over 30 years ago, and it was $300. Well, I was going to school with 3 kids and a house and a wife, and you know, I don't know where I got the money, but I went, and it just changed everything. I remember the Dr. Ferreri who taught the class. The first thing he said, he said, you're going to learn some things this weekend that are going to change your lives and the lives of your patients. And he said, but once you have that knowledge, he says, it's a curse, because once you learn something, you can't unlearn it, and it's your responsibility to use it. And I took that to heart, and he was true. And I graduated from school, started to work, treating people, and getting great results, and having fun. And I learning about nutrition as I went, and then 7 years ago, my son, who was 31 at the time, it was in April, he called me up and said, Dad, he was working about an hour away during the week, and he'd drive home to see his wife and on the weekends, and he was running a crew of guys. Actually, he was negotiating leases for wind farms. He loved it, absolutely loved it. He called me and said, Dad, I'm having a tough time breathing. He said, I can't even talk on the phone without losing my breath. And I said, well, buddy, you gotta get in and get evaluated. So he had a guy that worked for him take him to University of Michigan emergency room at the hospital. Make a long story short, he ended up having a tumor, 17-centimeter tumor in the center of his chest, mediastinal tumor, and 3 other tumors half that size below his diaphragm, stage 4 lymphoma. And that was in March, and in July, he, as I cradled his head, he took his last breath, and that changed a lot of things for me. I kind of rededicated myself to learning as much as I could to help as many people as I could, before I left this thing. So it actually put a big damper in my practice. I lost a lot of time, spent every dollar I had to try and save them. And it's a few years trying to get back on my feet in the practice after that. Dr. Curt approached, I got involved with PEMF, and that intrigued me. Found out my son had been treated by a machine about a month or two before he died, and he just had a great result. I mean, it didn't save him, but it gave him a lot of relief last month. And so I started selling PEMF machines, got involved, and got a lot of people talking about it. And the guy who runs the company said, why don't you start selling them? And I did. And that's how I met Dr. Curt at a conference. I think it was in, where the heck was it? Vegas, was it, Curt?
No, we were in Chicago.
Chicago. Okay. Yeah.
Yeah, we were there.
They all run together after a while, but so we became friends. Kurt's a pretty good guy, and then about, I don't know, within the last year maybe, he started talking to me about this Sizzle stuff. And to be quite honestly, I was involved in another MLM that I wasn't really. I love the product. Company is great. I was just having some problems with my upline, and blah blah blah. And I was in really no mental state to talk to Curt about another network marketing program. So one day, about 2 months ago, I guess, he called me on the phone and verbally knocked me down on the ground, kicked me in the head, and said, "You got to try this stuff." And I said, "Okay, if you put it that way, I'll do it." And right after that, the H pill came out, and I got some. And I've been taking a lot of stuff for a lot of years, and I was exposed to Agent Orange in Nam. So I've been kind of watching what I've been eating. I've taken a lot of supplements to kind of detox over the years. So I thought I was in pretty good shape. And I started taking this darn H pill, and I've had lesions on my skin, on my cheek, and on my leg that I've had for years. And they keep watching them at the VA, and that. And I'll be darned, within about 10 days of starting to take this H pill, they're going away. Now the one on my face is completely gone, and the ones on my leg are like 95% gone, and getting better by the day. So I figured there's really something to this. I've had the opportunity to talk with Tom Maurer a couple of times and realized this guy kind of knows what he's talking about and has a vision that I have never seen before. And I just figured that I was probably, for once, the right place at the right time with the right stuff. and I can see that this company, these products, are going to help a lot of people, and they're actually going to make a lot of people financially a lot better too. I mean, there's nothing like an MLM program that works for giving you some financial security. So that brings us up to today, Curt. In a nutshell.
Yeah.
I mean, it's a long.
Yeah, and then the other day, when on was it Friday when I had you guys talking to Tom about the fucoidan. I mean, isn't that just an amazing product in itself?
Yeah, and let me correct the story a little bit. It wasn't me that had the experience with the fucoidan in the past. It was a good friend of mine who's he's a quantum physicist. He was a physicist in the Navy, became a physician assistant. He's one of the smartest guys I know, and he had been involved with a company that did fucoidan 10 years ago and was actually one of the top or one of the top 2 distributors in the company. And they changed their product, and it just wouldn't do what it did before. And he told me he's been on the lookout for 10 years for another fucoidan product, because he says, I got hundreds of people that are waiting for me to come back to them with a fucoidan product that works. So when I told him that I told him about the age bill, he kind of got excited. When I told him that a fucoidan product, he really got interested. And then after we talked with Tom, I mean, I learned a lot about fucoidan, and my buddy just he's on fire. He said, we got to get this thing going. So that was a really interesting 1 hour on Friday.
Yeah, it really was. And Dr. Kim, I know today we're not really kind of talking about any diseases. We're not talking about, a lot of different things in specifics. But, this morning when I was talking to you, I thought, hey, what a great time. I'll just bring you on the call, introduce you, and let people kind of in Sizzle world, Sizzle land, find out who Dr. Kim Shunkwiler is. And, I mean, you've seen some amazing things happen in your practice. I remember when you and I met and you showed me that picture of the man who had basically his face melted off with radiation therapy and using the PMF and having his face grow back. I was like, holy cow. I mean, we can do some amazing things with what we got.
We get led in directions sometimes that we're not really, know where we're going, but we just feel like we got to go there. And that was what happened with PEMF. I just knew I had to get involved. And this guy was one of my first patients. He had parotid cancer, so they did surgery, and they did radiation therapy on his face. So I personally think they screwed up and left the machine on too long, because they ended up burning his ear off, and they burned his sinus. I mean, the poor guy was just miserable. And he had this wound on his face about the size of a fist that just would not heal. And this had been 4.5 years, and they had tried everything, and nothing worked. It was open, seeping, just like it happened yesterday. Nothing would grow. He worked in a plant, car factory. Of course, he was in the Detroit area, so he'd have to put gauze on it every day, trying to keep the dirt out. But it was just miserable. And we started treating him with the PEMF, and it was within 12 days he was like 85% improved. The skin was changing, and it was just exciting. And it shows you what can happen when you work at the cellular level and get the cells to start working again. And that's something I don't think the medical doctors truly understand generally. I know I hate to make a blanket statement like that, because there's some very good medical doctors out there that understand it. But when I talked, I actually ended up 2 years ago filling in for Dr. Gordon, speaking at a conference. It was down in Dallas, to the Academy of Comprehensive Integrated Medicine, to about 120, 150 medical doctors. And I talked about, let's work at the cellular level and what can happen. I showed him pictures, and and I actually had some of them come up and hug me afterwards. And it was like the light bulb went on for a lot of them. So we are in an area of what I call the new medicine, where we're looking at, restoring cell function. If you think about it, there's only one disease. That is cell dysfunction. Everything that you try to put a name on, whether you call it arthritis or uveitis, it's a condition of cell dysfunction. So if we can get the cells to start working, going through their normal process of growth and division, and then probably most importantly, apoptosis or cell death, where they have to get rid of the bad ones, and people can heal to just about anything. So that's what got me excited about Sizzle, because I know Tom Maurer understands all this stuff. He understands it much better than I do on how to actually make it happen. And these products, especially, I've been on the H pill for 3 weeks, and the ripped product for just about 4 or 5 days. So, and I've already noticed, changes in my body. It's exciting stuff. And for those of you on the call that are involved, I congratulate you, because I think we're on it for in for a great and fabulous journey.
Yeah, and Dr. Kim, as we finish out the call, I want to say, you've been in it for a little bit longer than I have, or maybe about the same amount of time. It's been 30 years exactly for me, and over the course of time, I would say that really, the cost of healthcare has gone up tremendously from 30 years ago, but yet the health of our country, the health of people, has actually gotten worse. And you'd think that with all the money that we spend on healthcare and all the money we spend on research, wouldn't you have thought that it would have gone the other direction? Just, let's finish out the call with, maybe some things that you might have to say about that.
Well, it is. It's sad. I go out to the VA hospital, and I see a lot of my brothers out there. I walked in the other day, and a guy ahead of me was in a wheelchair, rolling himself along, and he had a backpack on the back of his chair. I guess he planned on being there all day, because he had 2 half-liter bottles of Mountain Dew in his backpack, and he had a bottle of Coke in his lap while he was rolling himself along. And I know he had diabetes, and I know, people just, and that wasn't the only guy I saw like that. It seems like they issue Coke and Mountain Dew to every person that came in the damn building or the hospital. It's unbelievable. You go to the grocery store and you see people filling up in those little carts, walkers or motorized carts with the basket in front, and it's full of Doritos and potato chips and Mountain Dew, and people are killing themselves. And they don't know that they've got it, what they can do to stay healthy. They go to the doc, the traditional medical system, and they just are given drugs to cover up things. And we've got a challenge. If we can get to people and educate them about, where true health comes from, Katie bar the door. We can help a lot of people. It really is. You're exactly right, Curt. We've got a absolutely phenomenal, I guess you say it's a target-rich environment for what we have to offer.
Yeah, I really think so. I really think, Dr. Kim, you're dead on with that. Is that I think the biggest challenge is that, the first thing people always ask, of you and I anyhow, they're not going to ask the general public this, but they ask us, is it covered by my insurance? And that's the hardest part, is that we have to learn to educate people that, look, your insurance is there to take care of you when nothing else works. But it's up to you to make those changes. It's up to you to say, hey, I'm going to get on that age pill. I'm going to get on that RIP product. I'm going to take that fucoidan, and one way or another, I'm going to figure out how to be on those things to make these changes. And that's really what I try and tell people. And wouldn't you say that people are hungry for this kind of knowledge, right?
Oh, well, yeah. I think our challenge is not that they're hungry. Our real challenge is to make them hungry. because they don't know. I think a lot of people just don't know there's an alternative. And our challenge, and I know we face this as chiropractors for 30 years, is educating people the fact that there's another route for you to take. There's some other things you can do to get healthy. You don't have to just keep pouring drugs into a thing that's just going to cover up your symptoms, or just buy a new cane so you look better when you walk. I mean, that's our challenge. I think it's all education. And of course, then you got to know, once you educate them that there's an alternative, you got to be able to offer them that alternative. But I remember years ago, I took when I was in the insurance business, I took a sales training class, and the guy said, if you're going to sell somebody something, you first got to empty the bucket of their satisfaction. You've got to make them realize that their current state of affairs is not the best state of affairs, and they can change it. And that's where we're at now with this. And it might be a little bit easier now because there's more and more people that the light bulb's going on. They're understanding that, and it's becoming there's more educational material out there. They're maybe getting people to think that maybe there is something different. So I think we're in the right place at the right time with the right products.
You bet. Yeah, the other day on Sunday morning, I was attending a meeting, a special meeting, and it was really good. They had a guest speaker, and they said, sometimes the most important thing isn't the wow factor. Sometimes it's the ow factor, like
right.
Ouch.
Yep.
Yeah.
And
you have to tell people something that hurts.
Exactly, I agree. So I think that's the same. That's just a different way of saying the same thing. Is you got to make them realize that what they're doing is going down a dead end path, and that hurts sometimes when you realize that what you've been thinking for years is not exactly right.
Yeah.
So.
Yeah, and everybody, they'll go to the grocery store, they'll stand in a line for the register, they'll go to Disney World and stand in a line and everything like that. And in case of what you and I are doing, in the case of what everybody here that's listening to this call is doing, I mean, we're basically saying, look, we're starting a new line. We're starting a new line, and it's not standing in line to get the new drug. It's standing in line to figure out how to get our health back.
Right. Right, exactly, and that's probably the main thing. And then you have the opportunity, from the business point of view, to show people a way where they can maybe, if they just want to get their own product paid for by sharing with a few people, they can do that. Or if they want to make more income than they've ever made before, they can do that just by seeing the big picture and working a little bit.
Exactly.
They can make their dreams come true.
You bet. Well, Dr. Kim, our time is up. I appreciate you being on the call with me today and sharing and, just really letting people kind of know who you are, because I'd really like to ask, and I know I didn't even ask you before this morning if you'd be on the call, and you volunteered to help me out. And would you be willing to maybe jump on once a month with us?
Well, yeah, you got $1?
I'll send you a container, a little packet of Ripped to have you on once a month.
No, I'm kidding. I'd love to. I want to be part of getting as many people as we can to see the big picture and get better. That's what it's all about. That's why we do what we do. So sure, I'd love to.
Excellent.
And thank you for asking, by the way.
Well, thanks, Dr. Kim, for joining us today, and everyone, thanks for being on the call. Get this out to people. Let them know that they really, sometimes you have to buck the system. Sometimes you have to maybe offend people a little bit to get them to listen, and it's all right. You're doing it for the right reason. So thanks, everyone. Have a great day. Dr. Kim, you have a wonderful day out in Michigan, and DW, have fun out in Pennsylvania.
Thanks, buddy.
Bye-bye.
You mentioned my name in Colorado. Just don't tell them where I'm at, okay?
I won't tell them you're in Michigan.
Okay, thank you.
All right, bye, everyone.
Bye-bye.